Dr. Weighman, thank you for joining us today. Thanks for giving us your time to talk about eConsults. Welcome.
Sure.
And I was just hoping you could just do a brief introduction about some of your background and what brought you to the realm of eConsults.
So I'm a UK trained family medicine doctor and a sports medicine primary care physician. I came to Canada about 11 years ago now, and prior to that I was in professional sport with a Premiership soccer team and the England rugby setup, so second team and under 21 level. I've worked at the Glen there in Edmonton since being in Canada, and I currently work at the University of Calgary Sports Medicine Centre. Prior to coming out to Canada, I set up an interface service between primary and secondary care for triage and treatment of non-surgical orthopedic problems, including spine. I realized that the interface between primary and secondary care, it's really a knowledge gap. And what that's used to result in is obviously referring the patient into secondary care to see a specialist. And a lot of these patients don't need to see a surgical specialist because they don't need surgery. They just need more conservative medical management of their problems. So I got increasingly interested in how to provide healthcare for patients that was more patient-centric, more accessible for patients in a quicker turnaround rather than being waiting on an outpatient waiting list to go and see a specialist that they may or may not need to see. Whereas what they really needed is somebody just to look at their file and their data and give the primary care doctor some guidance about how they might manage the patient's problem in primary care without necessitating them going into the hospital. And I regularly do electronic consults for primary care practitioners in Calgary, giving them advice about managing spinal problems and non-operative musculoskeletal problems in their patients. So if we look at it from different perspectives, if you look at it from a primary care doctor's point of view, EMD have made it very, very simple for a primary care doctor to submit an electronic request for a consultation. The traditional way of writing a referral letter, dictating it up and printing it off and signing it and sending it to the specialist who may or may not look at it for a considerable period of time, you take all that out of the equation. So it's a much quicker turnaround. The primary care doctors are still asking the same questions of the specialist. It's just that it happens in a much quicker way. So from a patient's point of view, instead of sitting on a specialist's inbox for however long it takes for them to look at the referral and however long it takes to get the patient into the clinic, they can turn that around in 48, 72 hours and send a treatment plan recommendation back to the primary care doctor to enable the primary care doctor to continue to manage the patient conservatively in primary care. And it's a lot quicker. It's a lot quicker.
How long does it take you to review? If you're reviewing an eConsult, what's the average time it would take you to go through that?
So the EMD system is very simple to use. All of the supporting documentation that gets submitted by the primary care doctor is put into the dashboard. You open up the patient's file, you read all of the documentation. There's a link to Netcare where you can look at the relevant images. And then once you've done that startup work in terms of developing templates for common problems, it takes very little time. It probably takes less than 10 minutes.
A big shift, even less than it would maybe just to sit down with the patient.
Exactly, yeah. When I was at medical school, I was told it takes 2 minutes to say hello. So you don't have to say hello to the patient because you just got the information there in front of you. All of the issues in terms of patients turning up in outpatients without necessarily having the right investigations, having all the information presented to the specialist at that time to enable the specialist to make a clinical decision about what's the next appropriate treatment for that patient. You filter all that out by doing it this way, because I can send a report back to the family doctor and say, well, you should really do an MRI because this patient's got particular arm or leg pain and they need an MRI for us to make clinical decisions. If they didn't go through that process, the patient would wait to go to an outpatient department. The specialist would then say you need an MRI. The patient then has to wait to get an MRI, which just delays their treatment even longer. So doing it this way, you can make sure that when the patient does ultimately need to be seen in secondary care because they've exhausted conservative management options in primary care, they have all the relevant investigations and they've been through all the relevant processes and they've trialed conservative treatments that have failed, and therefore they become more appropriate to be seen in secondary care because that's their next step in the treatment pathway. So my experience in the UK is that if you manage patients conservatively, and depending on what discipline you look at, 85% of patients who go into general orthopedic outpatients don't need to be there to see a surgeon because they're not going to have an operation as their definitive treatment. So you can weed all those out before they see the specialist, and what tends to happen is that ultimately the patients who then do end up seeing the specialist because it's appropriate for them to do so, or they've exhausted conservative management, what we call a conversion rate in terms of how many of those patients that the surgeon sees in outpatients ends up on an operating list, goes up dramatically. So my experience is in general orthopedic outpatient department, it went from 15% conversion rate to 85%. And in spinal consultations, it went from 5% to 95%. From a patient's point of view, potentially their primary care doctor gets guidance from a specialist how to manage their condition without the patient even having to go to the hospital.
So, I mean, sustainability for the entire system is better now because we're seeing patients more efficiently.
Exactly.
That's kind of what you're getting at, yeah. How do you see e-consults like this supporting greater access to care and improved patient outcomes?
I think it's already been proven that it provides greater care. I think it depends on the specialty. I think information-based or image-based specialties like maybe dermatology, hematology, endocrinology, that sort of thing, where the patients are going into secondary care to see a specialist because their primary care practitioner feels that they need advice on how to manage the patient's problems. And in old-fashioned way of delivering that care, it meant the patient had to go to a hospital outpatient department several months potentially down the road whilst they're still suffering from the problem to see a secondary care practitioner to move them on to the next stage of their delivery of care. I think it's got tremendous potential. It's been around and people have been talking about it for at least a decade, if not longer. From a consumer's point of view, if you want to call a patient a consumer, there's massive advantages to not having to wait several months to get basically an opinion about what to do next to manage their condition. So I think from patient perspective, it's huge. I think from a cost-effective point of view, it's massive. For simple closed-loop medical problems, it's very much an attractive option. There's some private players in the marketplace who provide that sort of interaction with the patient so they can book a virtual consult on their smartphone or their laptop and have a booked consultation with a primary care practitioner for $20, $25. And patients find that very palatable in terms of when they take into account the overall cost in terms of time and travel and everything else. Something like 35 to 45% of all primary care consultations between a doctor and a patient is information exchange. So if we look at different ways of providing that, it has massive benefits from a patient's point of view. I personally feel it has benefits from a doctor's point of view. It's a much, much more cost-effective way of providing healthcare in a lot of clinical circumstances.
You talked about continuity of care, and you talked about some of the other private options. Can you talk about how introducing eConsults into practice can help alleviate some of those threats?
I think a lot of doctors need to be a little bit more business savvy than maybe they are. We've been operating in an environment where we've had an oligopoly, and we don't necessarily need to be quite as receptive to our customers' needs because there's far more patients than there are doctors. Any business has to address what their customers' primary needs are and meet them and deliver them. And if they don't, then they're not going to compete very well in the marketplace. Patients for sure want to access care in this way. I think if we don't embrace it through the state-funded system, then a lot of it will go into the private sector. We need to evolve and look at different ways of providing non-traditional ways of providing healthcare for patients, because patients will want it and demand it, and if we don't provide it, they'll go somewhere else. simple economics as far as I'm concerned.
Well, Dr. Weighman, thank you so much for your time. That was very, very, very helpful.